Welcome to this webinar brought to you by the Administrative Simplification Group in the Office of E-Health Standards and Services at the Centers for Medicare and Medicaid Services. My name is Kari Gar. Today we will provide a brief overview of the Health Plan Identifier and Other Entity Identifier policy, and we'll walk through a decision tree that may be a helpful resource when determining whether an entity qualifies for an HPID or an OEID. In addition, we will review some frequently asked questions that were submitted to Insurance Oversight at hhs.gov. Since October 1st, those interested in the HPID and OEID are able to go into the Health Plan and Other Entity Enumeration System, what we're calling HIPPOs, to create an account so they can access educational materials and receive email updates about the HPID and the OEID. Applications to obtain the HPID or OEID will not be available until first quarter of 2013. We hosted 2 webinars in October about the HPID, the OEID, and HIPPOs, and we anticipate hosting additional webinars in the coming months that will focus on different subjects related to the HPID and the OEID. If you are interested in these webinars, we encourage you to register for an account in HIPPOs. The slides from these webinars are available on the CMS website. The link will be available at the end of this presentation. In addition, there is a YouTube video available with this information, and that link is available at the end of this presentation. Taking a look at the agenda, we will begin with an overview of the HPID and OEID policy, and then we will walk through frequently asked questions. So what is the purpose of the HPID? The primary purpose of the Health Plan Identifier is for use in the standard transactions. Therefore, the only required use is that covered entities use HPIDs to identify a health plan that has an HPID in the standard transactions. While this is the only required use, the HPID may be used for any other lawful purpose. For example, a health plan may choose to use an HPID on a health insurance card. We are not requiring that health plans now be identified in the standard transactions if they were not prior to this rule. So, for instance, in the case of a third-party administrator that performs health plan functions on behalf of, for instance, a self-insured health plan, if the TPA and not the self-insured health plan was identified in the standard transactions prior to this rule, then the TPA can continue to be identified in the standard transactions after the HPID is required. The only requirement is that if a health plan that has an HPID is identified in the standard transactions, then it must be identified using an HPID. In order to obtain an HPID, an entity must meet the definition of health plan at 45 CFR 160.103. But because the definition of health plan is very broad, we created the definition of controlling health plan and sub-health plan to differentiate between health plans that must obtain an HPID and those that are eligible but not required. We define the controlling health plan as a health plan that controls its own business activities, actions, or policies, or is controlled by an entity that is not a health plan. And if it has sub-health plans, exercises sufficient control over the sub-health plan to direct its business activities, actions, or policies. We define a sub-health plan as a health plan whose business activities, actions, or policies are directed by a controlling health plan. As you can see on the chart, while a CHIP is required to obtain an HPID, there are different options available for the enumeration of SHIPs, based on the CHIP's organizational structure and needs. The CHIP will need to analyze its organizational structure to determine if and which of its SHIPs need an HPID based on whether the SHIP needs to be identified in the standard transactions. So here are the timelines for compliance. Health plans, excluding small health plans, must obtain an HPID by November 5, 2014. Small health plans have until November 5, 2015 to obtain an HPID. Small health plan means a health plan with annual receipts of $5 million or less. All covered entities will be required to use the HPID in the standard transaction if they are identifying a health plan by November 7, 2016. While these dates may seem far off, we want to stress that health plans need to begin planning now for enumeration and implementation. We would encourage health plans to use this time prior to enumeration to analyze their business needs and determine the best way to enumerate their organizations. The time period between enumeration and full implementation will give all covered entities the opportunity to make system updates and changes and perform testing prior to the November 7, 2016 date. So what is the Other Entity Identifier? Essentially, it is just a voluntary identifier for entities that need to be identified in the standard transactions, but they are not eligible to obtain an MPI, an HPID, and they are not an individual. So, for instance, a third-party administrator could choose to obtain an OEID to identify itself in the standard transactions. Now let's take a look at this chart that provides another way to interpret and think through the HPID and OEID policies. Before we start reviewing the chart, I want to clarify that I will be referring to controlling health plans as CHIPs and sub-health plans as SHIPs. Also note that there are cites to the regulatory text that correspond to the specific requirements. Looking at the first box, we begin with the fundamental question: does the entity meet the definition of health plan at 45 CFR 160.103? We'll start by going through the yes pathway, that yes, the entity meets the definition of health plan. The next decision point is whether the health plan meets the definition of controlling health plan at 45 CFR 160.103. If the answer is yes, then the health plan is required to obtain an HPID for itself. The analysis continues. Does the CHIP have SHIPs? If yes, then the CHIP may obtain HPIDs for its SHIPs, or direct the SHIPs to obtain HPIDs. While we anticipate providing further guidance on the difference between CHIPs and SHIPs, and whether a SHIP should be enumerated, some questions to consider in this analysis are: 1. What transactions do the CHIP and its SHIPs conduct? And 2, how are the CHIP and its SHIPs identified in the standard transactions? Going back to the original question, does the CHIP have SHIPs? If the answer is no, then the health plan does not need to take any further action. Now we'll go back to the question, does the entity meet the definition of controlling health plan at 45 CFR 162.103? This time we will look at the pathway if the answer is no. The entity does not meet the definition of controlling health plan. The question then becomes, does the entity meet the definition of sub-health plan at 45 CFR 162.103? If the answer is yes, then the SHIP may obtain an HPID. If the answer is no, then the entity is not eligible to obtain an HPID. If an entity reaches this box, there may have been a mistake in an earlier question. For instance, determining whether the entity meets the definition of health plan or whether the entity meets the definition of sub-health plan. So we would encourage the entity to go through the analysis again. Now we will move to the other side of the diagram and look at the analysis if an entity does not meet the definition of health plan at 45 CFR 160.103, and therefore the entity is not eligible to obtain an HPID. The question then becomes whether the entity needs to be identified in the HIPAA standard transactions. If the answer is no, the entity is not eligible to obtain an OEID. If the answer is yes, then the entity must determine, is the entity eligible to obtain, or does the entity already have a National Provider Identifier, NPI, or an HPID, or does the entity meet the definition of individual at 45 CFR 160.103? If the entity answers yes, then the entity is not eligible to obtain an OEID. But if the answer is no, then the entity may obtain an OEID. Now we will turn to some frequently asked questions. When can an entity obtain an HPID or OEID? We anticipate that applications will be available first quarter of 2013. As discussed earlier, we encourage entities to perform an analysis of their organization prior to enumeration. There are also work groups that have formed to discuss HPID and OEID implementation and use in the transactions. Two organizations that we are specifically aware of that are hosting work groups are the Work Group for Electronic Data Interchange, WEDI, and ASC X12. Where does the entity obtain an HPID or OEID? They will both be available through the Health Plan and Other Entity Enumeration System, or HIPPOS, which is a module on the Health Insurance Oversight System. For more information on HIPPOS and how to register for an account, please see one of the earlier webinars that is posted on the CMS website. The link will be available on the last slide. What are the standard transactions? The standard transactions refer to all of the HIPAA transactions for which the Secretary has adopted a standard. These include healthcare claims or equivalent encounter information, eligibility for a health plan, referral, certification, and authorization, healthcare claim status, enrollment and disenrollment in a health plan, healthcare funds transfers and remittance advice, health plan premium payments, coordination of benefits, and Medicaid pharmacy subrogation. Will there be specific guidance from HHS or the standard development organizations on the use of the OEIDs within the standard transactions? Our intent with the adoption of the OEID was to create a standard identifier and allow business needs and efficiencies to drive its adoptions and uses. We anticipate providing examples of potential uses of the OEID in the standard transactions in the future, but encourage others to review the directions within the relevant implementation guides to determine appropriateness of using the OEID in particular data fields. Again, as we mentioned before, we currently know of two different initiatives that are beginning to explore these questions, WEDI and X12. Is the HPID required to be used on the ID card? Will the ID cards in the WEDI implementation guide be changed or updated at all? While we did not require that the HPID be used on the ID card, it is a permitted use, and the HPID standard that was adopted is consistent with what is required in the WEDI Health ID Card Implementation Guide, and we would recommend that entities explore the use of the HPID on the card. Because we do not regulate the ID cards, we cannot comment on how the regulation will impact the WEDI Health ID Card Implementation Guide. What is the expected use of the HPID and OEID in the NCPDP version D.0 transaction request and response? We did not propose or finalize any changes to the NCPDP version D.0 standard. So, where D.0 calls for the BIN and PCN to be used, the final rule did not impact or affect, and we emphasize that we do not believe that the HPID should be required in place of the BIN and PCN identifier in retail pharmacy transactions. Can the HPID be used in the standard transactions prior to November 7, 2016? The final rule doesn't prohibit the use of the HPID prior to November 7, 2016. Unlike some HIPAA standards that we have adopted, for example ICD-10, we do permit the HPID to be used in the standard transactions prior to the compliance date. Therefore, if some covered entities decide that they would like to begin using the HPID in standard transactions prior to November 7, 2016, that would be permissible. However, these decisions are private business decisions that are strictly between trading partners. If you have any questions regarding the HPID or OEID, please send them to insuranceoversight@hhs.gov. We encourage everyone interested in the HPID and OEID to register for an account in HIPPOS. The October webinars and the YouTube video provide information on how to access HIPPOs, and the link is above. We anticipate holding future webinars and are open to suggestions on topics. Please submit these to insuranceoversight@hhs.gov. Information on future webinars will be available at the CMS website and through HIPPOs. Thank you for viewing this webinar.